right. I want to welcome all of you to our amazing panel of speakers and all of you that are pretty amazing people here. So thank you for coming. My Manny's has a rich history of social justice, and I think this is no different tonight. So thank you for coming out. And I especially want to thank Adam Hirschfelder, who has really worked his butt to make tonight happen. So thank you, Adam. I'm Dr. Alan Siegel. I've been working for Contra Costa County with the underserved for about 25 years as a family physician. And I'm also the co-founder for Social Prescribing USA. And pretty much every day I figured out that I've been working about 6,000 days at my clinic over 25 years. And pretty much every day is hearing about anxiety, depression, chronic pain, chronic disease. And as I think about what I really have to offer people, you know, obviously there's things like move and eat well, and we'll hear more about that tonight, I think. But really, I have therapy to offer, and I have pills to offer, and very quickly I run out of my tools. So we're here tonight to think about how can we add more things to what we can do, things that are really healing for people. And I want to offer real healing for my patients. I've seen lots of amazing things through the arts. I've been out in nature with my patients. I've done programs at regional parks. We have done, I've worked with them around social determinants of health. So I've gotten a lot of experience. We did medical group visits, so getting to experience creating community and how powerful that can be. And then I think in the wake of COVID, thinking about all that we've appreciated around loneliness, we have mental health crisis, we have losing like 25% of our clinicians in healthcare, so people can't see doctors anymore. We're at a moment of desperation, as my patients do. They don't change until they really have to, and I think we're kind of at that moment when this opens up possibilities of really looking at creative ways of healing, because what we're doing right now isn't going to cut it. So that is super exciting when it comes to what we're going to talk about tonight. We are celebrating the first ever Social Prescribing Day today in the United States. So thank you all for being part of that celebration. We are 5 years behind the UK in starting that. They started in 2019, and now social prescribing is widespread there, but they've been really doing holistic healing a lot longer than that, and so we've got some catching up to do. Social Prescribing USA activated. We have we call our community of practice, which are people around the country who are implementing programs around social prescribing. And so we activated our group, and people got together. And earlier today, we had a virtual conference at 1 o'clock, where we had 100 people show up, and some leaders from around the country. And I think one of ours came from the UK. And people, there's just a lot of energy around this. And we also had another sonic social prescribing experience from a place called Kokoro. And tomorrow we're having training around social prescribing. And so a lot of people did a lot of work to kind of bring this to attention for the first time in the United States today. Obviously there's been some social prescribing already, and that we want that to grow. But this is a moment, and so I'm really glad that you guys are here for the moment. And we have about 29 other countries now celebrating Social Prescribing Day today, so we are later to the picture. So our speakers tonight will speak to you about how you can think about community as your medicine, how loneliness is being addressed with vets, how Art Pharmacy is bringing art prescriptions around the United States and now at Stanford. And so let's take a step back, think about how we might be able to redo this healthcare thing a little bit, base it more in holistic healing, base it more in equity, and move forward. So I'm going to introduce the moderator for tonight, Dan Morse. And I've had the pleasure to work with Dan for the last 2 years to help kind of get this ball rolling and advocate for social prescribing to become widespread across the United States. Our goal is for that to happen. We set 2035 as a goal for that to be widespread, and we're still shooting for that. So this may be part of that. Dan is a visionary and had the insight 4 years ago to identify that loneliness is a problem, and saw people across the pond doing this work and said, why can't we do what they're doing? And so he's been talking to everybody he could possibly talk to over the last bunch of years, and now it's really getting momentum, and people are paying attention. So it's really fun to have you guys as part of this, and I'll hand it over to Dan.
All right, thank you, Alan. Hi, everyone. Good to see you all. So I want to start this off before we bring up the speakers and get personal with you. So raise your hand if someone you love, someone special in your life who you know well, occasionally sometimes suffers from anxiety or depression. Let's see, okay, that's almost everyone. How many of them have you even lovingly worked with to try to support, and it just seems like the solutions of therapy and pills just aren't cutting it, and you're like frustrated and being like, there has to be another way. Like this is really, really tough for my loved one. Okay, so what we're talking about today is not like a theoretical or even practical healthcare innovation. You're going to hear a lot of words like that, but this is about this is about that person in your life. It's about that person in all of our lives, and it's about a social movement that has been started because of people like us who wanted to find another way. And a lot of the origins and the growth of this social prescribing movement has come from some groundbreaking research that's really, really inspiring. So they did research at Harvard School of, the Harvard Flourishing Program did research. They took 13,000 senior citizens and found that if you volunteer 3 hours a week, there is statistically significant decreases in all-cause mortality. There's a lab at Cornell that found that volunteering twice a week for 20 minutes a day can decrease stress and anxiety. Going into nature 20 minutes a week can decrease stress and anxiety. That's small. And the World Health Organization, about 3 years ago, did a research study. They did a review of 3,000 studies on art's impacts on health, and found practically all measures, both mental, emotional, and physical, improved when people are engaging in self-expression and purpose. And there's a very famous research study that, if you're interested in loneliness, you probably have heard of that loneliness is akin to smoking 15 cigarettes a day. So there's this groundbreaking research. It typically takes 17 years for research to make its way from the labs, from the journals, into practice in our healthcare system. And with things that are, these are things that are not just beneficial. They can have positive side effects. You know, you might go out into nature, and you might go with a friend and then get invited to something else. Or you might be volunteering, find purpose, and benefit someone else. You know, where pills might have side effects, these sorts of things can have positive side effects. So there's a number of people, and you're going to hear from a number of leaders in this room, who thought, this is amazing. We got to make this more widespread. And so over the past 5 years, myself, Alan, and a lot of the folks nationally have been finding ways to bring this practice to the States. So some of the progress, there's a pilot happening at Cleveland Clinic. There's now over 50 organizations attempting social prescribing pilots, many more doing work by other names. And I get, through our mailing list, dozens of people every week signing up saying, how can I research this? How can I participate? How can I be involved? Within the past 18 months, we've done a small conference at Harvard, one at Columbia, a series of events with the New York Federal Reserve Bank, because they realize that so much economic activity that's going to the pharmaceutical companies could be spent locally on things that actually create health instead of just treating sickness. And so today you're going to hear from 3 leaders, Alan alluded to some of them, who are really pioneering this practice nationally and paving the way for people like us to pick up the baton so that we can serve the loved ones in our own life with a new paradigm of health, a new way of thinking about wellness, and a new tool for self-care that's going to change the entire world. So with that, I'm going to invite up our first speaker, Elizabeth Markle, who's doing absolutely incredible work. She's the co-founder and executive director of Open Source Wellness. She's going to tell you a little bit about their work, but they're enabling this work in clinics all around the country. So give it up for Elizabeth.
Thank you, thank you. Hi. Oh, look at that. Hi. I'm Dr. Elizabeth Markle. Everybody calls me Liz, and I hope you will too. I'm a psychologist by training and a professor of community mental health at a university right down the street here. And I worked for many years in integrated primary care behavioral health, which is just a lot of words to mean being the therapist or the psychologist that's supporting the healthcare system directly. I worked in emergency departments and tiny clinics and the giant San Francisco VA Medical Center. We've got some VA folks here. And during that time, I got very, very interested in what I now call behavioral prescriptions. And this is when a doctor or a therapist says something like, you should exercise more, or you need to eat better, or you should reduce your stress, or even something like, you need some social connection, you need some support in your life. Anybody ever heard one of these or delivered these? Yeah. So these are fundamentally good advice, right? There's nothing wrong with the prescription. The problem is that it's usually followed by something that sounds like, all right then, good luck with that. Take care now. I'll see you in 6 weeks or 6 months. And that's the end of the conversation. It's a prescription to nowhere if you don't have a lot of privilege and a lot of resources to hire yourself a private health coach and take up Pilates and start shopping at Whole Foods, etc. So in 2016, my co-founder and I said, what would it look like to design a behavioral pharmacy? Like if we're going to make behavioral prescriptions, what would be the delivery system on the other side that would catch people? And we started right in Oakland in partnership with a local federally qualified health center to build out what this would look like. And here's sort of what it looks like. We support participants with a universal prescription that we abbreviate MOVE, Nourish, Connect, and Be. Physical activity, healthy food, social connection, and stress reduction. And we do this based on the prescriptions of their providers. And it's been a long journey to go from tiny pilot to group medical visits to now drawing down Medi-Cal funding via CalAIM, and now talking with our partners about how this gets spread. But one of the commitments that we made early on was that we were going to be not informational, but experiential. Saying, you know what, people don't need to be told again and again and again what they should do. They need a place to do it together in community with support and make it fun. Experiential medicine. So I think it would be a little ironic of me to stand up here and talk at you about experiential medicine. Everybody talks about microdosing these days. Would you be open to a microdose of community as medicine? Yes. Oh, you opted in. This is informed consent right here. Okay. If you're game for this, and if it works for your body, would you please stand up and find yourself facing someone you don't know? You need a buddy. That's somebody you don't know. You could say hi. You're my buddy. right, look this way if you would. All right, look this way and just wave at me if you can see me. Perfect. All right. We said move, nourish, connect, be, and right? We're gonna try to microdose all of them except for the food. So, if you are the shorter partner in your pair, would you raise your hand? Shorter partner. Excellent. If you're the shorter partner, that makes you temporarily the boss. In that, however you move your body, your taller partner is going to mirror you, like so. On your mark, get set, go. Okay, freeze wherever you are. Switch roles. Other person leads. Go. Okay, freeze wherever you are. We're going back to the first leader. Here's my challenge. See if you can make your partner do something truly ridiculous. Go. Freeze wherever you are. Switching to the second partner. This is your last chance to get back at them. Go.
Okay, so we're gonna do
Okay, you did it. I wish you could see what that looks like from up here. Give your partner a high five and go ahead and have a seat. It is generous of you to do that with me. So we laughed, we connected, we played. I'm going to invite you to just for one moment bring your attention down and in. If you like closing your eyes, you can, but you certainly don't need to. Just take a moment to pay attention to what's happening inside your own skin. You might notice what your mind is doing, what your emotional body is doing. No need to change anything, just notice. And then I have a question for you to reflect on, which is, if you were your whole life's doctor, not just your body's doctor, your whole life's doctor, what would you prescribe for yourself? If you could write a prescription on one of those little pads for your whole life's well-being, what would it be? For some, it might be really concrete. I am going to walk more. And for others, it might be softer. It might be like, I'm going to be kinder to myself. So whatever it is for you, I invite you to take 30 seconds, turn to somebody near you, and if you're willing, share what it was. I'll get you back in about 30 seconds. Go ahead. going to grab your attention back here. Just turn your eyes this way when you're ready. How are you feeling? You doing okay? We awake? Yeah, thank you. So here's kind of how it works with open source wellness and this community as medicine model. We are in partnership with, I think, 13 federally qualified health centers now in Alameda County. And based on provider prescriptions into the model, we get these aggregated referrals from many, many of these clinics. And we train the providers to say something like this: I'm going to write you a prescription, but it's not for medication. It's for participation in a community that's dedicated to well-being. If the patient is interested, they get a phone call from one of our coaches. And this is not like a 2-minute sign-up call. This is like a 10 or 15-minute relationship building conversation where they will ask, what hurts? What would make a difference in your life? How can we support you? And if it's a good fit, they get enrolled in a group that meets every week. There are groups that meet virtually. There are groups that meet in the clinics, in English, in Spanish, long groups, short groups. And during those groups, they practice those 4 things: move, nourish, connect, and be. And we've been tracking the outcomes on this since 2016, and we're seeing dramatic drops in emergency department visits, in depression, in anxiety, in social isolation. We're seeing increases in physical activity and fruit and vegetable consumption. And we are now in partnership with a food as medicine program that's providing doorstep delivery of regeneratively grown and organic produce alongside this social prescribing initiative. So, I don't want to take too much more time, but I'll say the most exciting thing on my radar right now is a partnership with the YMCA. See, 80% of the US population lives within 5 miles of a Y, and I didn't know that. And the YMCAs are having something of an existential moment because they're no longer the only swim and gym in town, right? 24-hour fitness, and they've got a problem there. But they are increasingly motivated to be positioned as the trusted partner of the healthcare system, the delivery system partner, and seen as an integral part of that continuum, and really filling a need that the FQs cannot necessarily build for themselves. So our Community as Medicine Learning Collaborative is training 4 big YMCAs. We have San Diego, Seattle, Denver, and Y of the North, which is Minneapolis, St. Paul, to deliver Community as Medicine. And that means training local individuals with the cultural competence and humility and the linguistic skills to become nationally board certified health and wellness coaches via our program that focuses on trauma-informed coaching and group coaching. So we are about 1/3 of the way through that program. Each of those Ys will be launching their programs in September. And by this time next year, I will hope to have outcomes plus 20 more Ys that are getting ready to roll this out. So I will pause there. I'll just say I'm so happy to be here, and I'm excited to be in conversation with each of you. Come find me afterwards, and let's talk about how we make this go. Thank you so much for bringing us together.
And we're going to have a Q&A at the end. So there's a saying in social prescribing. For the past century, doctors have been asking the question, what's wrong with you? What's the matter? Where in the world of social prescribing, we like to ask, what matters to you? Let's build a strengths-based approach and get connected with community and activities that can help us thrive. So we heard from a healthcare implementation. Something that's interesting about social prescribing is it doesn't just happen in healthcare. Really what a social prescription is it's listening to someone and helping them to understand what could help them thrive, and giving referral to nature, community, arts, volunteering. And many of you who are part of organizations might be thinking, what are the applications outside of healthcare? How can I partner? How can I get something like this in my organization that also cares about the well-being of the people we touch? And so we're next going to hear from a really incredible pioneering duo who has set up an arts prescription program. We have Deborah Cullinan, who's a vice president at Stanford, and we have Chris Appleton, the CEO of Arts Pharmacy. So let's hear from you both about your amazing program.
doing every other.
Anything works. Tell us about your program.
Hey, Deborah.
Hi, Chris.
Hi, everybody. My name's Chris Appleton, and I am the founder and CEO of Art Pharmacy. It's an honor to be here. I live in Atlanta. Thanks for having me. Incredible work that you're doing. Incredible work. Like, another round of applause. Art Pharmacy is coming at social prescribing from a different lens. We're a startup healthcare technology company. We think, we know that doctors, healthcare providers, counselors have been doing community referral since the beginning of doctoring. Like, there's nothing new about community referral. And about 40 years of research, part of which Dan referenced, makes really clear that engaging with the arts improves health outcomes. Artists have been healers since the beginning of time. But those two groups, doctors and artists, are ill-equipped to work with one another. There are certainly exceptions to that, but our systems are not built for them to work together. And so Art Pharmacy is the plumbing, the infrastructure to make those two systems work together. And we're incredibly grateful to work with Deborah and the team at Stanford Arts to bring arts-based social prescribing to Stanford students.
Hi, Chris. I'm so glad to be here. My name is Deborah, and I have been here in San Francisco for a very long time. So I worked on this block for probably close to 15 years at Intersection for the Arts, a long time ago. So glad to be here and glad to be back. I will say, I guess, just a couple of things about why Stanford is doing this, and maybe a few things about how we've got it working so far. So I'm the first full-time vice president for the arts at Stanford. I've been in the role for approximately 2 years. And part of my role is to oversee a portfolio of really extraordinary organizations, like our museums and our performing arts presenting organizations, and a bunch of other academic-facing units. And I report to the president, and I point that out just to make sure that it is clear that being able to bring the arts to that table and to have the arts and what we know about art and creativity a part of every conversation has been so important. Art and safety on campus, art and mental health, art and how we think about neighborhoods or culture building. And one of the things that I heard a lot when I first got to Stanford was art should be everywhere. And of course it should. But I think that what a lot of people meant was a public art program, art on the walls, art on the stages, which is absolutely true. Art should be everywhere. And it should be integrated into the systems and structures that make up the daily life in our communities. So I think of my role at Stanford as being part of it to be able to be a platform for demonstrating how we could do that. And so given, as Chris said, what we know about the evidence is in and it is mounting, art is good for us in all kinds of ways. And so we know this to be true. So our job was to look for the systems across campus that we could integrate the arts into. And in so doing, support students and the community around us, but then also think about Stanford as a platform to contribute to the momentum that we're seeing in this country. So we can talk a little bit about how the program actually works. Do you want to do that? Do you want me to do that?
Sure. So there are many different what we call prescribing partners on campus at Stanford, from wellness coaches at Vaden Health Services to student affairs and housing, and an emerging partnership with the athletic department. And all of these different stakeholders on campus have a common challenge And it is that, and this is certainly not unique to Stanford. This is just, pick up a newspaper. This is true at every college campus across the country. There's a student mental health crisis going on. There's a real need for students to get access to timely, culturally relevant, accessible care. And it's a challenge at universities across the country to really meet that demand. And so that's an important role that the arts can play. So at Stanford, we have our prescribing partners that write a prescription, typically for students for 9 doses of arts and culture. And then via electronic referral, just like it happens at Walgreens or CVS, a prescription gets called in to Art Pharmacy. And the student connects with the Art Pharmacy Care Navigator. The Care Navigator helps talk to that student to understand the student's chief complaint, their health concerns, their health goals, any access barriers that may exist, their preferences and curiosities around arts and culture. And then our technology matches that unique member profile to the highest efficacy arts and culture engagements available to them on campus, which happen to be all of the incredible arts and culture programs that Deborah and her team are responsible for. And the students participate in those programs. We are assessing and monitoring the student each step of the way so that we can certainly know the outcome, the impact over the long term, but also in the short term to really get smart and precise about that medicine. I think this is one of the things about sort of community as medicine or art as medicine is the feedback loop is quicker. And when you're written a prescription for a SSRI, for an antidepressant, typically your doctor says, come see me in 3 months or 6 months and let me know how it's going. Well, if it's not going well, people stop taking it and then they don't go back to their doctor. But when there's this closed loop kind of feedback that happens where you're checking in with the member after each engagement that happens certainly more frequently than every 3 months or 6 months, there's an opportunity for us to learn what is the right kind of care. Oh, the group dance workshop wasn't the right thing for you? Well, let's maybe try to send you to the theater, or let's send you to the painting class or the ceramic studio, right? To really get the right kind of care to the right person, the right place, at the right time.
Amazing. Let's give it up for Chris and Deborah. Now, how many of you? Okay, so we've heard an example in healthcare. We've heard an example of an amazing partnership at a school. How many of you have a friend or a contact, someone you know who's served in the military or is a veteran? Let's see a raise of hands. Okay, so this next part will be especially relevant to you, and it's also an example of how social prescribing can be brought to the national stage. So with that, I'm going to invite up Lori Murphy, who leads the Compassionate Contact Corps at the U.S. Department of Veteran Affairs. Let's give it up for Lori.
Hi.
Hi.
I'm Lori.
So Lori, let's hear a little bit about your program and how you're thinking about integrating this idea of social prescribing into the services that the VA provides to veterans.
Yeah, I kind of want to start off giving everybody a scope about VA healthcare. I've worked at VA for about 7 years now, and I'll be honest, before I worked there, I didn't really understand how VA worked. So I'm going to assume there are some folks in the audience that feel the same. So VA is the largest integrated healthcare system in the country. We have 172 medical centers, and we serve over 9 million veterans. So we're pretty massive. About 50% of the veterans that we take care of are over 65. So you think about Vietnam era, Korean War, even a few World War II era veterans. So a really large older adult population. But then kind of conversely, almost a quarter of the veterans we take care of are between the ages of 18 and 44. So our Iraq and Afghanistan era veterans. So we also have a pretty large younger adult population. At least a quarter of veterans getting care at VA are diagnosed with PTSD, and we believe that's probably underreported. So we have a large population of patients with mental health issues. And then at least 20% of veterans live alone. So when you think about the risk factors for loneliness, you think about things like older age, younger age, and especially younger age and folks who are going through a transitional period. So think about that transition, exiting the military and going into civilian life. That's a pretty big transition. The risk factors for loneliness, you think about mental health issues, and you think about living alone. So in the VA, we have a pretty high-risk population of veterans, of patients that we're taking care of. They're at high risk for loneliness. And our internal studies show that. So we have an internal psychosocial screening. We call it the ACORN. It looks at all kinds of basically social drivers of health, transportation, food access, and social relationships. Consistently, social relationships, so isolation, loneliness, is rated as the second highest social need. Above transportation, above food, above housing, it's social isolation that veterans are telling us they're struggling with, 29% of them. So VA recognizes, with this data that we have, in addition to all the other research out there just from the community, that loneliness is a pretty big issue for our veterans, and we need to do something to address it. So they've really caught on to this idea of social prescribing for our veterans. A lot of veterans tell us they want more whole health type programming to address their medical needs. So one of our best practices for social prescribing is Compassionate Contact Core. So it is a social prescription where we're matching trained VA volunteers with veterans who are feeling lonely. And those volunteers call their matched veteran about once a week for friendly conversation and companionship. So it's a phone buddy program. And I readily admit this program is not super unique. There are lots of phone buddy programs out in communities. My parents used to volunteer through their church in a very similar program. I think what makes Compassionate Contact Core really unique is that it's being organized within the healthcare system. So that volunteer is, an unpaid VA employee, and they are covered under that safety net of VA healthcare. If that veteran has a healthcare need, they have a direct contact back to the healthcare team. I can give you an example, and actually I think Jules Holtz, I think she did a talk earlier on your virtual. She has a book coming out this summer about social prescribing, and she features Compassionate Contact Core in it. She interviewed myself and Prince Taylor. He's the deputy director of our voluntary services, and she also interviewed a veteran and a volunteer who are engaged in the Compassionate Contact Core program. And I bring them up because that veteran's a really good example of a patient who is pretty disengaged with his health care. He's older, he lives alone, he's very isolated, he doesn't have any local family and friends. His health was declining, he was having falls, and he wasn't reaching out to us at VA for a variety of reasons. So somehow he got linked up to Compassionate Contact Core, and his volunteer started calling him, and kind of figured out through their conversations each week that this veteran was really struggling and was alone and didn't have the health care that he needed. So cut to many months later, that veteran now has home-based primary care, so he has a medical team coming out to his home. He has the medical equipment he needs to get a safe shower and move around his apartment. He has home-delivered meals. These are all things that are making him more independent to be able to continue living in the community and are improving his well-being. And he has a friend who calls him every week just to say, hey, what did you watch on TV last night? What did you make for dinner? Tell me about your dog. Somebody who cares. So Compassionate Contact Core started, it was really a pandemic program. There were 8 of us across the country, a couple social workers, a couple voluntary service specialists. In March, April of 2020, we were recognizing this growing issue of loneliness and kind of the urgency. A hallmark of a VA clinic is our canteens. So, it's just a cafeteria and a little coffee cart. But if you go to any VA facility, that is like the heartbeat of the facility, and it's just tables of veterans, all in their veteran hats, sitting around drinking coffee and gabbing like a bunch of schoolgirls. So it was heartbreaking in the pandemic to walk through the VA clinic and not see the veterans sitting there. The tables were gone and they were not there. So it was a visual reminder that, holy smokes, where are these veterans? Oh, they're all at home and they're not connecting anymore. And we had a bunch of volunteers who were now disengaged. They weren't coming into the clinics. So this was really kind of like a grassroots project to bring together veterans and volunteers and, well, let's just have them call each other. I didn't know about social prescribing back then. We didn't name it that. But I think part of why I was invited to come here today is because Compassionate Contact Corps has really become a great example of how quickly social prescribing can catch on for everyone. The veterans, the volunteers, and the clinicians, they all gave us such immediate positive feedback about what this program meant to them. We couldn't stop. It started as this grassroots effort and just flourished from there. We started getting outreach from other VA facilities with interest in how could they start up their program. And now, 4 years later, we're at over 90 VA facilities and growing. A couple years ago, I took it to VA's version of the Shark Tank competition. It was a big winner, and so I've been working with the VA's innovation ecosystem since then to really work on formalizing that replication and really put VA on the map as a social prescribing leader. And I'm really proud that we are there, and the veterans are really responding to that. So I didn't let you talk at all, but
no, that's amazing. Give it up for Lori. So we're gonna go a layer deeper with Q&A, but before we transit, first everyone just shake it out a little bit. I think we've been sitting for a little bit, so get the motion, get the blood flowing, and to tee up our Q&A, I'm gonna first throw a question back to you, which is we're going to turn very briefly with the people we're sitting next to. I want you to share, why are you here? There's a lot of stuff happening in San Francisco, a lot of stuff happening in the Bay Area. Why did you want to come here today and participate in this? So that's the first question. And then the second question is, what resonated with you, and what are your hanging questions? What are the questions that are still lingering and bouncing around your head after hearing all these amazing leaders share? And then we'll take some of those questions, and I'm sure that it'll blow a lot of your minds, and there'll be a lot more clarity that comes. So let's take a minute. Try to connect with someone you haven't met yet, and share the personal story. Share the personal story about why you're here. We're going to try to get through a lot of questions. So I'm going to say, when I ask the questions to the panelists, really, we'll try to maybe have one or two people answer each question, but really shout out, be like, no, I have something to say, if you have something you really want to say. And we'll try to get through a lot of questions. I first want to kick off with the first question. There's been a tremendous amount of progress in a short amount of time. There's still way bigger hoops to jump through to have this on a national scale. In the UK, this is a national program at the NHS. So you can go into any clinic in the NHS and get a social prescription. That's what we're aiming for in the US. I want to ask the panelists to kick us off. What do you think it's going to take to kind of bring this to a national scale? What do you think the movement needs to make that happen? Maybe if everyone wants to share I'm sure that there could be a whole dissertation that each of you share on this, but kind of some thoughts.
Money.
Data.
Money.
I was going to say data. We've got to have the data on how social prescribing is impacting overall health costs. I don't even think this is working. Overall health costs and impacting health outcomes.
Yeah, we're a nonprofit based in Oakland, and we've built it to be about 70% revenue based and about 30% philanthropy. And competing with venture-backed companies means we need major philanthropic investment to demonstrate real scalability. And so I think that's going to take political will to really take it from pilot here to this is the standard of care.
Those things, and a couple of dissertations, and specificity. And I was sharing this earlier. The problems that social prescribing is seeking to address and can address are really big problems, but they're not general problems. They're specific problems. And so our solutions and the versions of social prescribing that we are building and implementing and trying to fund and developing outcomes for need to be specific solutions to specific problems. And that's my challenge to the social prescribing movement is to be specific about the problems that we're trying to solve with very specific solutions.
And I would just add, yes, all those things. And from my perspective, it's also people. It's finding the people who can champion this work and multiplying them by sharing the data. And not just the data, the story of impact. Really telling the story of impact. So, when we talked about the program at Stanford, Chris mentioned our community referral partners. And we expected to maybe have a half a dozen. We now have 20. And that is because people are just raising their hands. And I think an important thing about this that we've learned anecdotally is that in this particular case, people who are dealing directly with students in this moment in the world that is so challenging and students are struggling, this is a wonderful thing to be able to offer. It feels maybe better than prescribing medication, and people want it. So the more we find those people inside of our communities and also at the systems level, the better. I mean, I've learned from Chris, it really could just take a memo from the right person to change things in the state of California.
And I'll say policy change takes a long time. Changing a healthcare system takes a long time. There's nothing stopping a general practice doctor from giving a social prescription other than the constraints of their time and all the other incentives that can take them away. And you can think about social prescribing on a national level, an organizational level, but I think what's most inspiring is thinking about it on a personal level. That person I asked you to think about, next time you're having a conversation with them and you're trying to think of ways to support, suggesting a social prescription, having people self-prescribe can be really revolutionary too. So let's get some questions from the crowd. We've got Adam over there and we've got Alan who have mics, and we'll try to get through a good number of these questions. So.
Thank you. Hi, my name is Carrie Lee, and I've been a healing artist, visual artist, for about 11 years now. I work with the Yountville Veterans Home, helping them create community through creative collaborations. I work with Stanford Hospital, doing art facilitation there, and love it. And have actually a big community of what we call intentional creativity facilitators, so art with meaning or purpose, behind me. And so wondering, how do we find this work?
I think this is exactly what I mean, that there are already so many people who are working in this realm in different kinds of ways. And one of the things that we have to better do is just connect. Just simply connect and coordinate, and I will repeat it over and over again. Tell the story of the consequential impact that art has in our lives over and over again until it just is. So there's that connecting, and you can find me at Stanford.
I'll say also the social prescribing movement really is a collection of movements. So for arts specifically, the Center for Arts and Medicine at University of Florida, Jill Sankey's been doing incredible work. Get on their mailing list. They have webinars. The National Organization for Arts and Health has a conference. We've participated and helped supported a number of online community of practices. And so it's about these people finding each other. But it's not just arts. Stephen Post and the Harvard Human Flourishing Program has been gathering a lot of folks around volunteerism in health. Don Rakow at Columbia has a student chapter program that's collecting a lot of folks focused on nature and health. So there's a lot of these sub-communities. Honestly, we should probably highlight all of them on the Social Prescribing USA website. But I think that's a good way to kind of get hooked in and kind of take a first step into diving deeper into this work. Let's see if there's any other questions. And I'm going to try to get through the questions. And if we're moving on to the next question, there's a panelist who's like, wait, I have something to say. Feel free to shout out.
Thank you. Hi, everybody. My name is Julene Johnson, and I am one of the co-directors of the Sound Health Network, which is an initiative of the National Endowment for the Arts with NIH Kennedy Center and Renee Fleming. My question that we get all the time at the Sound Health Network is, why are insurance companies not on board? And I didn't hear any of you mention that. I was just curious. So would love to hear your reaction to that.
Well, I think that both, I know that both Art Pharmacy and Open Source Wellness are working with insurance companies. The VA is a integrated payer and health system. So they are on board, but it's early. The analog to social prescribing that I like to think about is a program that many of y'all are probably familiar with that emerged about 30 years ago called Silver Sneakers. No one in this room can disassociate the idea that our health outcomes are connected to our physical activity level. We know that. It's obvious, right? But 30 years ago, that wasn't true. Right? Not everyone in this room would have said that. And a company emerged 32 years ago called Silver Sneakers that built a national network of fitness programs and physical activity programs for older adults at senior centers and YMCAs and community centers. And then after 7 years, took it to Medicare. And they say, look, Medicare, we're saving you gazillions of dollars. And now every single person on a Medicare plan, Medicare Advantage plan, has access to a Silver Sneakers membership or competitor Silver Sneakers, paid for by the U.S. taxpayer, right? So it is coming. Social prescribing being proliferated through the United States is coming, but it takes all of the things, the specificity, the outcomes, the political will, the people, to really make that happen. But health plans are participating today, and I believe very much so they will be at scale in a decade.
Yeah, I can add on to that, and thank you. When we started this 8 years ago, when I was a postdoc, I went to payers and I said, I have an idea, we're going to do this thing. And they basically patted me on the head and they said, that's cute. Show me your 10-year ROI data. That's what they wanted from me. And I was like, well, forget that. That's going to be a minute. And we watched Dean Ornish do what Silver Sneakers had done, except it took him 30 years to demonstrate that cardiac rehab programs and his whole program can save $30,000 per patient if it's at the right moment. So I think where we are now is that progressive, committed, values-driven executives in payers can greenlight these things at the pilot level, and we can be crafty in how we tuck these things under existing policy innovations. So right now, food as medicine is having its moment, right? There's food as medicine pilots everywhere, and open source wellness is getting tucked under food as medicine. So we're pairing food with the health and wellness coaching and the social connection. And so that sometimes results in having to cramp our style in some ways, but I think that is part of the path to full legitimization.
Awesome. Let's take another question.
Hi. I was actually curious about more of the interventions around human contact, because there's a whole kaleidoscope of things you're doing that are wonderful, but you mentioned compassionate conversations, but are there other things around relationship building or social connection that are interventions you work with?
Yeah, I can start with that one. The first one that's coming to mind at VA is VA Socials. So they're using our great peer support program and connecting with community spaces or community programs that are doing arts or activities of any kind and inviting veterans to come out to those. So go out in the community, connect with other veterans, but they're using a peer support to help take them to that. So it kind of reduces that anxiety around going to something new because the peer has that relationship with that veteran, and so they say, hey, I'll go with you. I'll call you and make sure you remember the time, and we'll show up together and we'll figure it out. It's been really successful. The creator of that, Jay Gorman, is actually also one of the Innovation Fellows. So his program has also spread. I don't know off the top of my head how many, but that's just another example. I agree with you. I think we have to have a variety of programs under the umbrella of social prescribing. There's not one magic wand that's going to solve it all. So.
And I would also just add to that too that one of the things that is so wonderful about Art Pharmacy's model working with a care navigator is that in this sort of intake, getting to know, in our case, the student, you're also learning how they feel about their own social connections. And a lot of what is happening and what actually are barriers for these young people is they don't want to go alone. And so, great, then bring a friend. That's part of the prescription. Let's make that work, or let's find a group activity for you. So I think in the case of the arts prescribing, it has a lot to do with social connection and people engaging with others or having collective experiences.
If you want to go deeper into this topic, the UK has a Minister of Loneliness, and I think it might be the Wellcome Trust in partnership with government gave out $11 million in grants projects for creative things in all across society, creative ways to address loneliness. And it's things as much as funding board games at community centers to friendly benches, which are benches in parks that have a sign that say, if you're sitting here, it's implied that if someone sits next to you, you're going to chat with people, which is really nice. And so there's an organization, Healthy by Design, which is doing urban design. And so it's hard to think about any of these things as sort of an isolated interaction, but it's more of an entire web, an entire ecosystem of how we interact. And so some folks are addressing it on that more macro level too. Let's have another question.
Hi. Thanks for being here. Great presentations. I'm David Pepper. I'm a family doc. I used to run Mission Neighborhood Health Center, which is 3 blocks that way. And I've worked for the county medical systems. So first I know, and I'm a good friend of Alan's, how many physicians in the room? Yeah, that's what I thought. None. None, right? Except us two. So, when we were talking, find a physician champion. I mean, they are there, but we are so stressed and spread thin. And sure, write a script, but nobody's going to, follow it. Follow the money. Pharma, 11 million is like 1 second of Eli Lilly. It's profit. It's ridiculous how much money they have. And then the other one is connections. How can the VA in Stanford talk to the students? And how can the students bring art supplies to the VA once a week? Because it's those partnerships. You guys are all on the front edge. I love Alan to death. We've been friends for many years. And, he does such good work. And you guys are doing good work. And I wish, I look forward to the day in, hopefully not 5 years when your report is out, or 25 years. But, if I could give you, other than $100 million to do your study, or, the shuttle to go back and forth from the VA to the student center, bring the vets in, even better, that'd be fun. What would be your dream? What's your, if you had a wish, right? And a lot of it's money, but maybe think of it that way. And again, thank you so much for your time.
I'll go first. One of the things I think of is the education piece about all of this. And we've all referenced it, how loneliness and social connections, it's just part of your overall whole health picture. You need enough sleep, you need a healthy diet, you need enough exercise, and you need to have social connections. You need to have relationships in your life to have an overall healthy lifestyle. And I think in this room, we probably all know that, and the message is starting to trickle out, but I think we need to do, one of my wishes is that would just be everybody would just know that is part of your health picture. And I think both clinicians, so physicians and nurses and social workers, but also the patients, I really want them to deeply understand and agree and appreciate how important having regular connections is to their overall health picture.
Has anyone here seen the Disney movie Hercules? Yes. And is anyone interested in Greek mythology? A little bit. So there's this scene in the movie where you see all the planets and the stars, they're kind of in the sky, and then they align. And then right when they align, the Titans, which are these incredibly powerful creatures, emerge from the ground. And I believe it's the origins of the saying, the stars aligned. And so the question is almost like, what is the stars aligning that's almost like a game over, like social prescribing is going to take off? What's the single biggest thing? I don't think that there's a single biggest thing. I think there's a lot of, we talked about a lot of different societal mechanisms, but if there was one thing, there's this policy thing called a Medicaid waiver, which emerged within the past decade, and it was designed with the insight that change in healthcare is so slow and so hard. So some state Medicaid programs, Medicaid serves low-resource populations, are creating these waivers, which are literally billions of dollars put towards experimental solutions for health promotion. And so to give you a sense, New York State's waiver is, across 5 years, is $13.3 billion. And so I've been working with some policymakers to try to get social prescribing written in. It's a little bit more complicated than that. But if that's done, then there can be a tremendous amount of money that is unlocked for experimentation, for implementation, for incredible organizations and programs like that I think could be really, really game-changing. Let's take some more questions. Take a few more.
Yeah, hi, I'm Debbie Lester. I'm from Federally Qualified Health Center in New York, Urban Health Plan. I'm the Chief Quality Officer, also a social worker. I was curious. It's very hard. I wanted to know how VA, how you want to scale up the volunteer program. It sounds amazing. How do you do that when it's so hard to get people? It's hard, just getting workforce, right? Especially since COVID, so challenging. So how are you going to try to scale that volunteerism? Crackers and juice? I hope that works. If it's that easy, we have it right away, right?
And you mean to get more volunteers?
Well, yeah, because you want to scale it. That means you need a massive amount of volunteers. So how are you going to go about that?
Yeah, we've done a lot of surveying of our current Compassionate Contact Corps volunteers to find out, why do you like volunteering with it? Why is this attractive? And it is a really unique volunteer opportunity because it's a pretty low time commitment. If you're just calling one veteran a week, that's one phone call a week. It's maybe a half hour to an hour. It's really flexible. You can do it on your own time. You can work your full-time job and still do it. So we're kind of feeding that survey data back to the veteran service organizations that we work with, the universities that we partner with, our volunteer sources, and they're really responding really well. I think part of the goal is just to get the message out that this volunteer opportunity is available. So that's really where we've started, and we've had really good feedback about it.
All right, we have time for maybe one or two more questions. So raise your hand if you got a burning question. We really want to make sure. Looks like we've got three left. Let's see if we can get through all three.
Hi guys, I'm Keely O'Brien. I'm a student over at UC Davis. And first of all, I love the art prescriptions, and I think that a lot of us, my friends and I, would definitely be a lot happier with an art pharmacy around for sure. But a big part of the student mental health crisis is honestly students just not having the time in the day to take care of themselves. And so I'm just kind of wondering, how does your team overcome the challenge of students not feeling like they're actually able to take any time out of their day to go and utilize these art prescriptions so often, like the 9 prescriptions or so that you said earlier?
Hi, I can't. Hi. It's a great question. I'm so glad you're here. And again, I think for our pilot, so much of this is about how customized it can be, and having a care navigator who can understand those time constraints. And the biggest constraint for Stanford students is certainly their time. And so figuring out how to match the activity to times that can work for them has been really important. And what's great about that too is that it also tells us more about when we should actually be programming for students anyway. Like, you know, we make all these assumptions about when people will come to a performance or go to an exhibition. Turns out we're wrong. So I think it's in that customized approach. And what's great is there's a check-in, there are check-ins all along the way. So if whatever we have prescribed ends up being too taxing on the schedule, or there needs to be a pause because it's the end of the quarter, and those kinds of things, we can adjust. Or if the activity is too time consuming, we could look for something that's less. So I think it's really in thinking about how by customizing something early on, which sounds like it might be very intensive, you are actually going to have so much more impact and probably save a lot of money.
I'll say another way of thinking about social prescribing that was really life-changing for me. So I think often we think volunteering, arts, nature, these are things that are like sometimes half day or like hour-long events. I think it's important, instead of thinking of it like, it's important to think of it on a time spectrum. So one thing that my wife and I do before bed is that I write a little story and she draws something every night before bed. And sometimes we pick a theme. And so it takes 5 minutes, and it totally changes the mood because we're fun, we're laughing. So, art, you can do it for 5 minutes. Volunteering, you don't need to always go to a center. Spend a minute texting someone, give time to someone in that way. In nature or exercise, in between calls on Zoom, you can do push-ups. These we can think creatively about applying this in our own life.
And also, when they were talking about dosing, that dosing is over 9 months. That's once a month. And that's really what a lot of the studies are showing, is once a month is as good for a lot of outcomes as exercising 3 times a week, which we consider like our gold standard of what you do. So it's not necessarily a time issue, because the arts are just very powerful.
Looks like we got one there, and then there's maybe one back, and then we'll close it up.
Hi there, my name is Eric Beatty, and I'm part of the drug development community working on Parkinson's disease. And after seeing the pandemic and the increase in loneliness and the division in this country, and seeing how my daughters responded in the last 10 years, I think there's a lot of people in my profession who think that what you guys are doing in this kind of social movement is more important than any single drug development. So I just want to give you some hope that the pharmaceutical industry is also on board. I'm concerned, how do we get the message to government, and how do we get the message to the insurance companies? How are we gonna pay for this for people who don't have the means to pay for this? And one of my thoughts, and you can add to this if you'd like, is the message of getting beyond art and music are anecdotally fun and nice to have. But we need to tell people that it's a need to have. And as a neuroscientist, I would suggest something like art and music and social interaction, just like what we've been through in this meeting, is much more globally engaging of the entire cortex, rather than doing a math problem or doing a crossword puzzle. So if we could get messages like that across, like why this is so important, because nothing else besides social engagement and art and music globally engage every section of the cortex, and that's what really helps and heals the brain. So I wish you guys all the best and all the luck, because we need more of this movement. Thank you.
So many thoughts. I think that the pharmaceutical industry has a role in the social prescribing movement. We'd be very interested in working with you. Serious, like why shouldn't the drug rep walking into the doctor's office with their bag of tricks not include both a drug and or access to nature or arts or volunteering? If they can sell that and make money on that, and it's proliferated I don't have an objection to that. I want health and well-being. I want dollars reinvested back into our community, to artists, to community organizations. Like, that's transformational of the system. The Sound Health Network is doing incredible work to help support the study of the impact of music on the brain. I had a great book, if you all don't know, Your Brain on Art by Ivy Ross and Dr. Susan Mag-Salmon at Hopkins. Talks just about this, about actually neuroaesthetics. So there's wonderful work that's being done. And how do we get the word out? Everyone go home and write your elected officials, write your health plan, tell your employer, if you get your insurance from them, hey, I want access to social prescribing as a part of my as a part of my health benefits. Like, that's what we should be. We should be demanding this of the people that are responsible for providing us access to care.
Ask your doctor.
Ask your doctor.
Amen. All right, we got one more question back here.
Hi, I'm Eunice Lynn Nichols with CoGenerate. We're a nonprofit that brings older and younger generations together to create a better future. I love the question about volunteerism as a way to drive the scaling of your work. And I've been curious for about 20 years about prescribing volunteerism because of my connection with Adam, and whether or not you could envision prescribing volunteerism, in particular across generational lines, to solve some of the social isolation and loneliness on both ends of the age spectrum. For example, could you prescribe younger veterans who are lonely to be the phone buddies to older adults, and older adults to be the volunteers to the younger veterans? Could you have Stanford students who are stressed out do art volunteerism at the VA? Could you have veterans be the volunteers prescribed as such to mentor some of the students? And might that be a way to solve multiple problems at once?
Totally, yes. Everything that you said, yes. And I forgot to mention earlier the impact of volunteering with Compassionate Contact Corps has had on the volunteers. They're lonely too. So you're exactly right that there's a lot of opportunity there in using programs like Compassionate Contact Corps and others for the actual prescription for loneliness. And the intergenerational impact has been incredible. There's been such great relationships built with young students and older veterans, and vice versa, young veterans and older volunteers. So it's really cool, and yeah, I love your comment. Mm-hmm.
Amazing. So raise your hand if you heard something that's making you think differently about your own health, or you might change the way that you do things. Let's see a show of hands. Awesome. Raise your hand if that person who I had you invoke at the beginning, you're now thinking about maybe having a conversation, or maybe if they're asking for a solution. Raise your hand there. Awesome. Amazing. And let's have everyone close your eyes and raise your hand if you might want to get involved or help drive this movement forward. Let me just see a show of hands. Awesome. Amazing. Great. And I'll kind of close out, and we're going to have some time afterwards so you can come and connect with us up here. And if you have any other questions, socialprescribingusa.com. We have a newsletter where we're kind of sharing a lot of amazing work, like the people up here. And we'll do a follow-up email. We'll point to everyone's work and social media if you're cool. I don't really have that much social media. I'm not really that cool. But if you have, these folks do, which is awesome. And I'll kind of leave, thank you so much for those comments from the pharmaceutical industry. It's really, really fascinating. I think one phenomenon that I think is interesting that I'll kind of close us with, and I kind of give a thank you to the pharmaceutical industry, is that there's kind of a bizarre aspect of many of these commercials for drugs. Someone kind of down on their luck, and then you see them kind of smiling and enjoying time and laughing, and then they kind of sit and they're like, oh, my back, and then my here, and then and they're and then they get back, then they're better again, and then you're like, wow, this person really figured it out. And it's by the way, side effects might include nausea, suicidal thinking, depression, and you're like, holy crap, and yeah, could be fatal. And so that's one of the challenges of drugs. They're saving lives, but there's also risks. But here's the thing that's really bizarre about those commercials. You look at You look at these commercials and you look at what they're doing. They're doing social prescriptions. They're going for a walk. They're painting and laughing. And here's the thing, social prescriptions can have positive side effects because that person you meet at the volunteering event might become your best friend. That art you make, that expression you have might be something you share with a neighbor that makes you feel connected. That nature walk might help you fall in love with the place in which you live and want to have a passion to take care of it. And so I think we know at our deepest intuitive sense that this is healthy. And it's more about having leaders up like the leaders we have up here who are pushing it forward, taking the brave risks of working in a health system and an education system that is trying to help sick people heal and pushing us towards a world where we can kind of take ownership of our health, ownership of our communities, and help people drive and jump into what's good instead of just fixing what's bad. And so I'm so glad that you all are here. Thank you so much. This is such an incredible conversation and such amazing questions. And we've got such an incredible group of folks here. So feel free to stick around. We should get a list, and if folks want to kind of think about volunteering, supporting any of the organizations or the broader movement, there's a lot of people doing amazing work. Kind of like how the work that Art Pharmacy does, kind of taking people in, listening, helping them get set up with the custom social prescription, the custom art thing that is tailored to them. We can try to work to find the best way for you and your amazing talents and gifts to contribute. And I think, in the least, just talk to your friends who are in need. Look yourself in the mirror and take good care of yourself. That's really what this movement's all about. So thank you so much for coming, and stick around if you'd like.